I'm Emily Mashak, and you are listening to Tuned Into NoCo, Town Square Media's show that lets you know what matters in NoCo. Today, I'm talking with Dr. Andrea Klemes, the Chief Medical Officer of MDVIP, about a new survey that shows how COVID-19 is affecting the overall health of Americans. So thank you for joining me today, Doctor.
Thank you for having me.
Now, before we get into the survey, I want to talk a little bit about you. What inspired you to get into the medical profession?
I always like to figure things out and help people. I think it sounds a little bit corny, but it's true. And so, just went through college thinking I'm just going to go out there and help people and graduated medical school. And I was in practice for a little while and then ended up coming to MDVIP where I can help guide 1,100 physicians take care of 350,000 patients.
That is impressive. Can you tell me more about MDVIP and what it is?
Sure. It's a national network of primary care physicians. We have them everywhere from Florida to Maine to Alaska to Hawaii. And they have the time, the tools, and the technology to really focus on patients. You get a 2-hour executive style physical yearly, and then they get to work with you all year long to help you set some wellness goals and really coach you and work with you to keep you at your healthiest. And so you can live a good, vibrant life.
And now the new survey shows that the pandemic is causing Americans lots of elevated stress. What are the primary concerns that you're seeing among Americans right now?
The survey showed that 1 in 2 Americans are stressed or depressed. 1 in 3 have developed some unhealthy habits like eating too much or drinking too much. And over 60% have canceled a doctor's visit. So when you put all of these things together, it's very concerning to me as a physician for the American short and long-term health.
Mm-hmm. Why do you think these stressors are more prevalent for Americans during this time?
Well, it is a stressful time. And it's interesting because the data showed that the over 65 population, the ones who I would have thought would be more stressed because they are at higher risk of complications, they are actually coping better. It's that sandwich generation, the 35 to 49 who are taking care of their parents and their kids. They are the ones who are struggling the most. 40% are having problems with their relationships, and 1 in 2 said they felt like they were losing their mind.
Wow. What would your advice be for Americans who can relate to those statistics and are feeling the same way? How can they alleviate some of these stresses?
Yeah, I think it goes into 2 buckets. One is medical. You need to find a physician to partner with you. 90% of people in the survey said that they trusted their doctor to know everything about COVID, but only 30% reached out. So you need to find a doctor like an MDVIP doctor who can take the time and really know you and work on your risk factors. Then there's the psychological side of it. I think there it's bringing some joy into your life. Go walk outside and get those endorphins going to make you feel better. If you have some negative people in your life, maybe try and get rid of them. Try and connect with family and friends. I know that's tough because it has to be virtual most of the time. But reaching out to people and keeping connected is always helpful.
Mm-hmm. Why do you think people are avoiding their primary care doctor right now? What do you think is behind that?
I think one of the things we found, and actually this came out in the data, one of the surprising things for me, 90% of Americans said they knew all about the virus. They know the symptoms, they know where they're going to get it, all that. But when we asked them to rank what the riskiest places are, public transportation they felt was the riskiest, which is pretty risky. But hospitals and doctor offices were high up on that list. So I think people are afraid of getting it there. Interestingly, the 2 safest places they thought were outdoor parks, which is pretty safe, and family and friends' houses, which is concerning because that's where most of the transmission is coming right now. You go to a friend's house, you take your mask off to eat, you kind of leave it off. And so I think education is much more important for people to understand doctors' offices are safe, hospitals are safe. You need to reach out or have a doctor who reaches out to you. Our MDVIP physicians are proactively calling our patients, reaching out to say, let's do a telehealth visit if the patient really doesn't want to come in the office or can't. But any way to keep in contact to understand how their chronic conditions are doing and if they need to change anything.
Mm-hmm. And now the survey also showed that the pandemic has had, I don't want to say positive sides because no one is loving this pandemic, but it has inspired people to improve their overall health in ways. Can you tell me a little bit more about those findings? And how do you think this newfound motivation will impact people's futures in the long run?
Right. 70% of people in the MDVIP survey said that they would prioritize their health now. 1 in 2 said they're going to eat better, exercise more, get their weight under control, or get their chronic conditions under control. So I'm hopeful there's a silver lining that people will start to get motivated and change things and get a little bit healthier, especially as we start to go into the winter months when most people, not in Florida, but most people maybe in Colorado slow down a little bit and, are inside because it's colder out.
Now, you talked a little bit about this earlier with going for a walk and getting your endorphins going, but what would your advice be for people who are looking to make those lifestyle changes to be healthier but don't quite know how?
Yeah, I think you need to reach out to somebody to partner with to help you with that, which is your physician. We have MDVIP physicians all over Colorado, and they can look at you and say, I think you need this type of meal plan or this type of diet. I mean, making small changes, if you were going to fry something today, bake it. One small change can give you one small win and make it easier for you to keep making changes.
Right, right. It doesn't have to be a whole change all at once. What else really surprised or struck you about the results from this survey?
Yeah, 7 out of 10 people said that they get very stressed out if people aren't wearing masks or social distancing. So happily, people are trying to do the safe thing. Of course, it is increasing their anxiety level a little bit.
hmm What would you say to people who have an aversion to wearing masks? I just ask because in Colorado, I think people are very divided about the situation. They may not see the value in it. What would you have to say to people who are on the fence about things like that?
I'm a scientist at heart, and there is a lot of literature, a lot in the scientific literature that shows that wearing a mask protects others, and there's also evidence that it protects you. I mean, it's a simple thing. I know it's not comfortable sometimes to wear it all day long and having problems breathing, but you need to find the mask that is comfortable for you and something that you can wear because this virus is spread by respiratory droplets. So it just makes perfect sense. If you have something covering your mouth, those droplets can't come out. And so you can't infect others. And then if you have a barrier, it's going to help you prevent breathing in those droplets from somebody else.
hmm What else would you like listeners to know more about this survey? What do you think is the main takeaway that people should have?
I think they need to take care of their medical side, find an MDVIP doctor if they need one, and then they need to just try and know that they're not alone. Many people 1 in 2 feel stressed or depressed in the survey. So everybody, this pandemic is taking a toll on everybody, but reach out to your doctor or your support system just to make sure that you are getting that support. And we're going to be in this for a while longer. I don't know how long it's going to be till we have a vaccine or herd immunity where, we'll be done with this. It'll take a while, so you need to really take care of yourself.
Where can listeners go to learn more about the survey?
Sure, they can go to mdvip.com. They can learn more about the survey, COVID-19, and they can find a doctor in their area.
Now, what other health tips would you have for listeners, whether they are related to COVID-19 or just in general? What would you like people to know?
Oh, a lot of people really don't know that 80% of deaths from cardiac disease could be prevented. Deaths from cancer and diabetes, all these chronic conditions can be prevented just with some lifestyle changes. And I know I sound like a typical doctor, eat better, exercise more, but these things really do help your health. And then if you are at a healthier state, if you do get a virus like COVID or even the flu, you'll come through it better. So just knowing what your risks are, you may not be diagnosed with diabetes yet, but if you're a pre-diabetic, doctors can diagnose that and they can help teach you what to eat more of and less of so that maybe you can stave off that diabetes for years before you even get that diagnosis.
That is great advice. Well, thank you for sharing that, Dr. Klemes. I appreciate you taking the time to talk to me today and sharing the results of this survey.
Thank you for having me.
Again, that was Dr. Andrea Klemes, the Chief Medical Officer of MDVIP. Learn more about that new COVID-19 survey at mdvip.com.